Hello, my name is Dr. Dorothy Carlson. I have a master's degree in Oriental medicine and a transitional doctorate in Chinese medicine, DACM. Welcome to Phoenix Natural Health. So today I'm going to talk about my personal journey with diabetes and weight loss. So, etiologies, for starters, at least in my case. I grew up in a smoker home. My dad was a chain smoker, and I was repeatedly sick. I was sickly growing up as a child. Respiratory illness, not thyroid, tonsils, strep throat, all that stuff. And then later on, I was in an auto accident and required a hysterectomy because it literally tore my uterus from the spine. And then a few years later, I had a cholecystectomy. Wish I would have known a little more about traditional Chinese medicine and how to have healed that gallbladder. Well, live and learn. However, losing organs, there is no, what do you want to say, help, prosthetics. If you lose a leg, you have an expert that can help you with a new leg, right? But that's not the case with organs. And I'm going to go into this in depth in future videos. But right now, the diabetes is pretty severe. And I requested some pharmaceutical help apart from the insulin and diet. So I'm controlling this, or working, that's a bad word, control. Right. I am working on treating this with intermittent fasting to stimulate insulin-like growth factors, a very, very clean diet, as far as I don't eat sweets rarely. I don't use bread excepting for maybe once a week for Shabbat. A lot of vitamins, a lot of herbs, and basically protein, vegetables, single item food. But I still have trouble with high blood sugars. I'm working on it. My personal belief is that God creates the cure, that the earth has the treatment for anything, pretty much anything, as long as your body's still intact. But anyways, with that being said, I've requested help. And my doctor, and by the way, I've tried different pharmaceuticals. Okay, I've tried different things. So this time we're trying Rybelsis. Now, Rybelsis is used to treat hyperglycemia or high blood sugar, but it's also being considered as a weight loss because people do lose weight on Rybelsis. Wonderful. I've gone from 315 down, and I'm about ready to break 200, but it's taken time. It's taken work. So that would be great to be below 200 again. Hey, I'll try it, right? Rybelsis comes in a pill form and also in an injectable under the trade name of Ozempic. I'm sure you've seen the commercials on this, right? So I started this medication just a short time ago, about a week ago or so, maybe 2 weeks. And I've seen the commercials about it. And of course, they have a whole bunch of people, that are taking the drug and they're all happy and they're at a party or something, right? And everything is cool. But they list the side effects. The big one that they mentioned is medullary thyroid cancer because according to drugs.com, the animal tests showed an increase in thyroid cancer when the animals were given Rybelsis. So that's why they put that in there. But they don't really go into the common side effects, such as nausea, vomiting, dizziness, headache, those type of things. They don't detail those very well. They kind of mention, but blown off. But then you see these happy people, and yeah. So anyways, the instructions from Novo Nordisk, which is the manufacturer, is to take the pill with a small amount of water, less than 4 ounces, very early in the morning. And the doses come in 3 milligrams, 7 milligrams, and 14 milligrams. Now, typically, as I mentioned, I do intermittent fasting. So I do an 18-6, so I'm on, bone broth, teas, water, herbs, vitamins for that 18 hours, and then I'll eat a meal. I might have 1 or possibly 2 small meals. So this works fine. I'll take the pill early in the morning and keep my fast, right? And then I'll eat later in the day. So a couple of days after I started this, a pharmacist called me about the side effects. At that time, I said, yeah, I'm having a little nausea, but no big deal. I expect that because I tend to be sensitive on medications and I don't have a tolerance for artificial stuff. Okay, I'm good. So a couple days later, I was out working, and I was hit, and I was nauseated. I was nauseated out there, and then I was hit with dizziness, like I was going to pass out. And the nausea was very, very intense, but without vomiting. I just was sick as a dog. I came home. Yes, I drove like that. And I laid down for 4 hours. The symptoms lifted. Next day, I was hit with symptoms. Not as dizzy, but nauseated. Oh my God, nauseated. Didn't throw up. Couldn't eat anything. Could barely sip tea. A few hours later, it lifted. And that's the pattern that I found, is you will get sick. I mean, lay down, crawl to the bathroom sick. Exaggeration on that, crawl to the bathroom, but you're very, very, very sick. And then it lifts. And you can eat a little bit. Now, Thanksgiving, this ruined my Thanksgiving. My son took us out to El Torito. They had a fantastic buffet there. Oh my God. So and I'm not loading my plate because I really can't eat, but I sampled a little bit. I had 4 green beans and I was done. I ate a little more and I was so sick, dizzy. Came home and I am running to the bathroom throwing up. Wound up throwing up 3 times that night. After that, I decided that I would go off the Rybelsis. I stopped taking it. Another thing I experienced was frontal headaches over the front of my head, which if you're in Chinese medicine, this is gallbladder meridian. And I didn't have abdominal pain. I just was intensely, intensely nauseated, intensely dizzy to the point of passing out. Of course, I reported to my doctor, where they're going to do some blood work. And of course, I have an appointment to see her and see what other ideas we have. And I'm also seeking, of course, somebody who's integrative medicine to work with me. I may have a doctorate in acupuncture and Chinese medicine, but I don't know it all. But what I've done has served me thus far. Now, in Chinese medicine, well, okay, let me backtrack. According to the drugs.com website, if you have stomach or an intestinal disorder, gallbladder disease, a history of pancreatitis, how about vision problems from diabetic retinopathy, or kidney disease, you've got to be cautious with this drug. I have no gallbladder, as I mentioned, and I am working on healing diabetic retinopathy. So this drug is called semaglutide, forgive me for butchering it. It's a GLP-1 receptor antagonist, that's its active ingredient, and it's along the same class as metformin. So in Chinese medicine now, In Chinese medicine, what I experienced was liver overacting on stomach, possibly liver yang rising with the headaches and the nausea and the vomiting. Now, understand that we have a wiring system in our bodies. Okay? Now, traditional Asian medicine has identified these according to 12 organs. Okay? Liver, heart, pericardium, gallbladder, spleen. All right, so if you're spleen qi deficient, it doesn't mean there's something wrong with your spleen. It means that there is a wiring problem with the spleen meridian. Okay? A lot of people will go and have their liver examined because they have liver yang rising. Okay, well, that's common for high blood pressure. But that doesn't mean there's something wrong with your liver. It means that we need to tweak the wiring in your house. And that's what an acupuncturist does. We use needles. We use movement, Tai Chi, Qigong. Okay, you've heard of those. We use diet. We use herbs to restore the functionality of your wiring system in your house, your body. So, this drug strongly affects the liver meridian, gallbladder meridian. I believe it affects the dew meridian because of the headache. And for me, I'm going to go back to my doctor and discuss the pharmaceutical side of this, of what I can do. Now, there are herbs that can mitigate side effects. And of course I'm using those. I've got to do it for everything just about now. So there's a tea of ginger, licorice, and red dates that I'm considering. There's other things that might help lessen the intensity of the side effects of the Rybelsis. I want the benefit of the lowered blood sugar. It's great seeing a blood sugar below 200. That's wonderful. It's great to get over this hump of 200 pounds. That would be wonderful. But the price tag that it is costing me for a month of being so sick you can't function, that you can't work, I don't know. I don't know. Please like and subscribe to my channel, Phoenix Natural Health. My name is Dorothy Carlson. And give your comments. If you can't say anything nice, I don't want to be blasted here, then please refrain. Okay? We don't need to have negativity, right? We have too much going on in the world. Peaceful comments, be honest, and maybe some of these drug manufacturers will consider more than just profits, will consider how it's affecting the life of these patients. Okay? So thank you for listening, and please enjoy your day.